Again, welcome to the committee.
Thank you, and good morning, Chairman Miller and members of the committee, and thank you for the opportunity to speak again on today's important topic. Today, we continue our focus on concussion, a type of traumatic brain injury, and its negative effects on the academic learning and performance of the student-athlete. Learning in school is the child's job, and that job is impaired after a concussion. The consequences of a concussion can be significant for the academic learning and performance of that student-athlete. Our current research finds adverse effects of this injury upon school learning of up to or close to 90% of the students that come to us in our clinic. They report a significant worsening of post-concussion symptoms when they attempt school tasks. But the effects of concussion are quite significant and can be quite wide-ranging, with an adverse effect on their ability to think and to learn and for their social and emotional functioning. The student also typically experiences physical pain with headaches and significant fatigue. These symptoms can be debilitating and disabling for a child's learning and their social interactions. The length of time to a full recovery following a concussion and of that functional impairment varies from days to months, and for some, even beyond that. Academic problems can also have significant downstream effects, especially for the high school student. For example, concussions at the end of a semester significantly reduce performance and grades on final exams, reducing the student's grade point average. Taking an SAT prior to recovery from a concussion can also have significant adverse impact on that student-athlete's college future. Are our schools currently prepared to handle the academic consequences of these injuries? Through our clinical work, we can clearly see that schools are very much caring and want to help students with these injuries, but they're often not adequately prepared to help them. They lack the necessary policies, procedures, knowledge, skills, and tools to properly support the return of the concussed student-athlete. In a survey we conducted this summer of 140 school nurses in the Washington, D.C. area, they reported that less than half of the schools were prepared to assess a concussion, and less than 1/3 were prepared to offer academic supports after the injury. Training with the new CDC Heads Up to Schools Know Your Concussion ABCs toolkit was very effective, though, in increasing that knowledge of the injury and ways to assess and to treat it. So how can we help students with concussions return to school? We know that these students typically do not meet the criteria for special education services, yet they're still not able to handle the normal academic learning and performance demands. And the reality is that the school learning environment places significant physiologic demands on that recovering brain. The effective management of these adverse academic effects is an important priority, and we have to provide effective supports that maximize the student's recovery and minimizes any long-term post-concussion problems. The Protecting Student-Athletes from Concussions Act that was introduced yesterday provides an important vehicle to improve care systems for students with concussions. This legislation places the focus directly on the student side of the student-athlete equation. It places the focus on supporting the academic learning and performance needs of that student-athlete after this injury. It focuses on what schools can actually do to support the academic return of that recovering student. So this legislation asks schools to, number one, develop policies and methods to implement concussion education and training of school and related persons, including parents, students, and coaches. Number two, it provides a range of academic supports to help those students as they're attempting to manage school. And third, it reinforces, through its response to concussion elements, the sport removal provisions of the Zurich Consensus Meeting and what we've seen in some of the laws, such as the Leistet Law. It also reinforces the need for appropriate evaluation to return the student-athlete back to the field and to the classroom to support their academic needs. So in conclusion, a concussion is a serious injury to the brain that presents significant risks and challenges to the academic performance and learning of the student. It negatively affects the primary job that they have. These academic problems, even if temporary, can have significant potential negative consequences for the student down the road. And if not treated properly, These academic problems can become prolonged and result in significant long-term difficulties for that student. We must assist our schools to become better prepared to properly support the return of the concussed student-athlete with the necessary systems put in place to improve the knowledge and the skill of our school personnel. The Protecting Student-Athletes from Concussions Act does this, seeking to develop and implement a national system of concussion education, protections, and academic supports for students with concussions. Now, this legislation promotes more effective recovery, and it will help return our students back to the schools effectively.